Have you ever wondered how many types of cardiovascular diseases exist and how they affect our heart and blood vessels? Well, it's quite a fascinating, albeit a bit somber, journey of understanding. Cardiovascular diseases, often abbreviated as CVDs, are a group of disorders that primarily affect the structure and function of our heart and blood vessels. These conditions are as varied as they are numerous, each with its own unique characteristics and implications. Some CVDs may cause the heart's arteries to narrow or become blocked, leading to chest pain or even heart attacks. Others might make the heart rhythm irregular or cause the heart to pump blood less efficiently. There are even those that affect the blood vessels outside of the heart or the ones supplying the brain, causing pain during physical activity or leading to stroke, respectively. So, are you ready to explore this intricate world of cardiovascular diseases? Let's delve deeper into the most common types of cardiovascular diseases and how they impact our health. The most common cardiovascular diseases include coronary artery disease, hypertension, and heart failure. Let's dive into these a bit more. First up, we have coronary artery disease, or CAD. This is also known as ischemic heart disease or coronary heart disease. It's the most common type of heart disease out there. But what exactly happens with CAD? Well, the coronary arteries, which supply the heart muscle with blood, become narrowed or blocked. This blockage is usually due to the buildup of cholesterol and plaque. This doesn't sound too good, does it? It can lead to angina, which is a fancy term for chest pain, or even heart attacks. Next, we have hypertension, more commonly known as high blood pressure. Now, blood pressure isn't inherently a bad thing. In fact, it's necessary for our survival. But when the force of blood against the artery walls is consistently too high, that's when we start to see problems. Over time, this can lead to various complications, including heart disease, stroke, and kidney problems. Last, but certainly not least for today, we have heart failure. Despite its name, this doesn't mean the heart completely stops working. Instead, heart failure occurs when the heart is unable to pump blood effectively. This could lead to symptoms like shortness of breath, fatigue, and fluid retention. Heart failure can result from various underlying causes such as CAD, hypertension, and valvular heart disease. So we've covered coronary artery disease, hypertension, and heart failure. Each of these cardiovascular diseases have their own unique characteristics, but they all impact the heart and blood vessels in some way. And remember, these are just a few of the diseases that can affect the cardiovascular system. There are several others that we will explore next. Other common cardiovascular diseases include stroke, peripheral artery disease, arrhythmias, valvular heart disease, cardiomyopathy, congenital heart disease, and rheumatic heart disease. First, let's talk about stroke. It disrupts the blood supply to the brain, either through blockage or bleeding in the brain's blood vessels. This can lead to serious neurological damage. Peripheral artery disease, or PAD, is another culprit. It's marked by the narrowing of blood vessels, often in the legs, causing pain and cramping during physical activities. Arrhythmias are irregular heart rhythms. Some are harmless, but others can be life-threatening. Valvular heart disease involves faulty heart valves causing narrowing or leakage. Cardiomyopathy is when the heart muscle becomes enlarged, thickened, or stiff, impairing its ability to pump blood effectively. Congenital heart disease. These are defects present at birth. They can range from simple to complex, sometimes requiring surgical intervention. Lastly, rheumatic heart disease is a result of untreated streptococcal infections that damage heart valves over time. Understanding these diseases can help us recognize their symptoms and seek timely medical help. Many of these cardiovascular diseases share common risk factors. Smoking, for instance, is a major culprit. It damages the lining of your arteries, leading to a buildup of fatty material which narrows the artery. This can cause angina, a heart attack, or a stroke. A poor diet, high in saturated fats and salt, can also lead to high cholesterol and high blood pressure, which are both risk factors for cardiovascular disease. A lack of physical activity can increase your risk of heart disease, as it may result in weight gain, high blood pressure, and high cholesterol levels. Similarly, obesity puts a strain on your heart and can lead to heart disease. Genetics also play a significant role. If your parents or siblings have had heart disease, you're more likely to develop it yourself. Lifestyle modifications, such as a balanced diet, regular exercise, and weight management, along with medical treatments, can significantly reduce these risks. Regular medical checkups, early detection and appropriate management of risk factors are key to reducing the prevalence and impact of cardiovascular diseases. Remember, taking care of your heart is taking care of your health.